At 67, Margaret was making her morning coffee when the left side of her body suddenly went numb, and she collapsed to the kitchen floor. Her phone was across the room, her neighbors weren't home, and she couldn't speak clearly enough to call for help. What happened next saved her life, and it's something every person over 60 needs to know. In the next few minutes, you'll discover the exact protocol that helped Margaret and thousands of others survive a stroke when they were completely alone, including one simple technique that can buy you precious time until help arrives. I've worked in emergency rooms for over 30 years, and I need you to hear me clearly. Most people over 60 will not survive their first stroke if they're alone. That's not fear-mongering, that's fact. Almost half of stroke deaths happen before the patient ever makes it to the hospital. Why? Because they waste time. They hesitate. They panic. They don't know the simple, life-saving actions that can protect their brain long enough for help to arrive. And the brutal truth is this: if you don't know these steps, you could be gone in minutes or left with permanent disability. Every single day, I've seen patients carried into my ER who could have lived independently if they had just done one or two things differently at home. Sudden numbness on one side, slurred speech, dizziness, confusion, and by the time they arrive, the golden window has slammed shut. But here's the good news. There are science-backed techniques, simple actions you can perform right now, even if you're completely alone, that can double your odds of survival and minimize brain damage. Not gimmicks, not myths. These are real strategies neurologists teach their patients. In this video, I'll walk you through 5 life-saving tips every senior must know to survive a brain stroke when nobody else is around. These are the very steps I wish every patient in my ER had practiced before their stroke. And wait until you hear number 2, it's so powerful. Research shows it can make the difference between severe disability and walking out of the hospital with your independence intact. Most people have no idea, but after today, you will. All medical references and scientific studies I mention are listed in the description below. Before we dive in, here's a quick question. How old are you? Tell me in the comments. I personally go through and reply to every single one like it's a conversation in my clinic, so don't hold back. Now, without any further ado, let's start with number 5 on our list. And it's the very first step that could decide if you make it out alive. Number 5. Recognize the signs using FAST and act immediately. Don't wait it out. The very first and most critical action when you feel the signs of a stroke is this. Recognize them fast and act without delay. Do not wait. Do not second guess. Do not tell yourself, maybe it's just a headache, or I'll see if it passes. Every minute you wait, up to 1.9 million brain cells die, leading to worse damage and lower chances of recovery. Neurologists explain it in simple terms. Time is brain. The longer blood flow is blocked, the more brain cells die, and the less chance you have of regaining speech, movement, or memory. Research backs this up. According to the American Stroke Association, patients who recognize symptoms and get help within the first hour have survival odds up to 40% higher and far less disability compared to those who delay. Yet, tragically, many seniors downplay their symptoms. Studies show nearly 1/3 of people over 60 wait more than 2 hours before seeking help, often because they think it's age-related or they don't want to bother anyone. That hesitation can be fatal. Picture this. A 68-year-old grandmother in Ohio felt sudden numbness in her arm one evening. She told herself it was probably just tiredness, drank some water, and sat down to rest. She waited for hours, hoping it would fade. By the time her neighbor found her and called 911, the damage was irreversible. Doctors told the family that if she had recognized the signs right away, she might have survived with minimal brain damage. That story repeats thousands of times every year. and it's preventable. So, if you're over 60 and you ever feel sudden numbness or weakness on one side, confusion, slurred speech, trouble seeing, dizziness, or a severe headache, act as if it is a stroke until proven otherwise. Use the FAST test. Face. Smile and see if one side droops. Arms. Raise both and check if one drifts down. Speech. Say a simple sentence and listen for slurring. Time. Call for help now. Even if it turns out to be something else, you've lost nothing. But if it is a stroke, and it often is, you've just taken the single most important step to save your brain. Recognizing the urgency is the first act of survival. But while you're waiting for paramedics to arrive, what you do next can keep oxygen flowing to your brain and buy you even more precious minutes. That leads us to tip number 4, a technique proven to get help faster when every second counts. Number 4, call emergency services immediately. Use your voice assistant if needed. Once you've recognized the signs, the next move can be the difference between life and death or severe disability. Call 911 right away, even if you're alone and struggling. Why? Because strokes happen when blood flow to the brain is blocked or bursts, and fast medical intervention, like clot-busting drugs, can restore flow and save brain tissue. The science is clear. A study from Johns Hopkins found that getting treatment within the platinum 30 minutes, the first half hour, boosts full recovery chances by 22% and cuts the risk of speech loss by 31%. But here's the catch. Speed matters. If your speech is slurred or your arm is weak, use a voice assistant like Siri or Alexa. Say something like, "Hey Siri, call 911, I'm having a stroke." This gets help without needing to dial manually. In a situation where every second counts, those moments can prevent major brain damage and save your independence. One retired teacher, 70 years old, was alone in her kitchen when she felt her face droop and speech slur. She remembered her doctor's advice, activated her phone's voice command to call 911, and stayed on the line. Paramedics later told her that quick call allowed them to administer TPA in time, and she walked out of the hospital 2 weeks later with only minor weakness. She still lives independently today. But here's where many seniors go wrong. They either can't reach their phone or hesitate because they're confused. If you have a medical alert button or smartwatch, use it. For everyone else, keep your phone in an easy-to-reach place as a precaution. Doctors emphasize, do not drive yourself. It's dangerous and delays treatment. Think of that call as sending in a rescue team to save your brain before the damage spirals. It doesn't cure the stroke, but it stops the clock on brain cell death. Acting fast with that call keeps the odds in your favor. But surviving a stroke alone isn't just about calling for help. It's also about how you position your body in those terrifying minutes. And that's where tip number 3 becomes crucial. Number 3, unlock your door and keep your phone nearby so help can reach you quickly. When a stroke strikes, every second is precious, not just for your brain, but for the people trying to save you. One of the most overlooked survival steps is also one of the simplest. Unlock your door and keep your phone within arm's reach. It sounds small, but in a crisis, it can mean the difference between being found in time or being trapped behind a locked door while precious minutes slip away. Here's why this matters. Paramedics are trained to break down doors if they have to, but every extra barrier costs time. And during a stroke, time is brain. Studies from the CDC show that for every 10 minutes of delay in treatment, recovery chances drop by nearly 10%. Imagine losing those life-saving minutes just because help couldn't get to you quickly enough. Unlocking your door in advance removes that risk. A 73-year-old widower in Arizona learned this lesson the hard way. He dialed 911 after sudden confusion and weakness, but collapsed on the floor before he could unlock his front door. Paramedics arrived within minutes, but had to waste precious time forcing their way inside. By the time they reached him, too much damage had been done. Contrast that with the story of an 80-year-old woman in Florida who unlocked her door, clutched her phone, and stayed in a chair by the entryway. Paramedics got in immediately, started treatment, and rushed her to the hospital. She survived with only minor cognitive issues. The second half of this tip is just as critical. Always keep your phone nearby, especially if you live alone. Too many seniors leave their phone in another room or plugged into a charger out of reach. During a stroke, even walking a few steps can cause a fall. Having your phone next to you ensures you can stay connected with emergency responders until help arrives. Some even recommend putting your phone on speaker so you can follow instructions without holding it to your ear. Think of it this way. Your phone is your lifeline, and your unlocked door is the bridge that gets help to you faster. Together, they eliminate barriers and buy back time you cannot afford to lose. Once the path for help is clear, the next step is about keeping your body calm enough to survive until that help arrives. And that's where tip number 2 makes all the difference. Before we go on, if you're getting value from this video, go ahead and tap that like button and make sure to subscribe and turn on the bell icon so you never miss out on powerful health tips like these. Number 2, take slow, deep breaths to lower stress and oxygenate your blood. In the middle of a stroke, panic is your worst enemy. When fear takes over, your body shifts into fight or flight, releasing a flood of stress hormones like adrenaline. This raises your blood pressure, which can worsen bleeding or blockages in the brain. That's why one of the simplest survival actions you can take is also one of the most powerful. Take slow, deep breaths. Breathing deeply does 2 critical things. First, it increases the amount of oxygen reaching your blood and brain, which is desperate for fuel when flow is limited. Second, it signals your nervous system to calm down, lowering the surge of stress hormones that put extra strain on your body. Research published in the Journal of the American Heart Association found that slow, controlled breathing reduced blood pressure and improved oxygen delivery, even in patients with advanced vascular disease. It's not a cure, but it gives your brain a fighting chance while you wait for help. A 76-year-old retired accountant from Michigan described how he survived his stroke by focusing only on his breathing. As the numbness spread down his side, he resisted the urge to panic. He sat down, closed his eyes, and began inhaling slowly through his nose, exhaling even slower through his mouth. By the time paramedics arrived, he was weak but still conscious. His neurologist later told him that those steady breaths likely stabilized his blood pressure and kept oxygen moving to his brain long enough for treatment to begin. Here's how to do it if you ever find yourself alone and in danger. Place a hand on your stomach, not your chest. Inhale deeply through your nose, feeling your belly rise. Then exhale gently through pursed lips, as if you're blowing through a straw. Aim for about 6 to 8 breaths per minute. Slow, controlled, and deliberate. This kind of diaphragmatic breathing not only helps the brain, but also keeps your mind focused when panic wants to take over. Think of each deep breath as buying yourself more time. Time for oxygen to reach your brain cells, time for your body to ease its workload, and time for paramedics to arrive. And if there's one more habit that ties all these survival tips together, it's the last and most critical one. The action at number 1 that research shows can double your odds of survival. Number 1. Position yourself safely and stay as still as possible. Movement can worsen damage. When a stroke strikes, your first instinct might be to move, to pace, or even to try and walk it off. But that instinct can be deadly. The number 1 survival rule is this: position yourself safely and stay as still as possible. Every step, every sudden movement can raise blood pressure or cause a fall, worsening brain damage. By keeping your body still and in a safe position, you reduce the strain, prevent injuries, and give yourself the best chance of surviving until help arrives. Science explains it clearly. During a stroke, blood flow to the brain is disrupted. Movement demands more oxygen from the brain. But with its supply cut off, that extra demand only increases damage. A clinical study in the European Journal of Neurology found that minimizing exertion and maintaining a stable position during acute stroke episodes reduced complications and improved outcomes. In plain terms, seniors who stayed calm and still had better recovery than those who moved around in panic. One 71-year-old gardener in Nebraska learned this firsthand. While outside, she felt sudden dizziness and weakness. Her first thought was to walk back inside for her phone. Instead, she forced herself to sit down safely and called for help where she was. Paramedics later told her that staying still prevented a fall and kept her blood pressure from spiking. She survived with far less damage than doctors expected. Positioning isn't just about stillness. It's smart. If you can, lie on your side with your head slightly elevated to keep airways open and reduce choking risk if vomiting occurs. Avoid lying flat, as it can increase pressure in the brain. Calmness isn't just physical, it's mental. Panicking floods your body with adrenaline, raising blood pressure and worsening the stroke. By focusing on staying still and practicing slow, deep breaths, you lower that hormonal surge and help keep your body stable. Tell yourself, I've called for help. My only job now is to stay still and breathe. This mindset prevents rash decisions like trying to walk to the door or grab something across the room. Actions that can trigger a fall before help arrives. Think of your brain during a stroke, like a fragile circuit shorting out. Every movement overloads the system and risks permanent shutdown. Stillness, calmness, and a safe position is the key to buying time. This is the final, most powerful habit. Do less, breathe more, and let help reach you. Together, these 5 tips form a survival map. And while you can't predict when a stroke might strike, knowing exactly how to act can be the difference between tragedy and recovery. And there you have it. 5 life-saving tips every senior must know to survive a brain stroke alone. From recognizing signs with FAST to calling emergency services, unlocking your door, taking slow breaths, and finally positioning yourself safely while staying still. Each action buys you precious minutes. Minutes that can mean the difference between life and death, or independence and disability. Remember this: a stroke doesn't always give you a second chance. But if you act fast, think clearly, and follow these steps,